Good morning and welcome to the Collaborative on Health and the Environment Alaska, or CHE-Alaska, teleconference on hidden chemicals in consumer products, what's not on the label, with guest presenter Robin Dodson of Silent Spring Institute. My name is Diana DeFazio, and on behalf of Alaska Community Action on Toxics, I'll be facilitating today's call. CHE-Alaska is a regional partnership group of the National Collaborative on Health and the Environment. CHE-Alaska aims to advance knowledge and effective action to address growing concerns about the links between human health and environmental factors. And you can find more information on the following websites: the Alaska Community Action on Toxics website at www.akaction.org, and the Collaborative on Health and the Environment website at www.healthenvironment.org. Today's call will last 1 hour. Except for the speakers, all participants are muted during the presentations, and there will be time at the end for your discussion and your questions. Slides of Dr. Dodson's presentation can be found by clicking on the title of today's call on our homepage at www.akaction.org. And I do recommend that you download the PDF of the presentation because the slides with a lot of data have small print and it might be difficult to read using the Microsoft PowerPoint web app. So that would be a great thing to do now if you haven't done so already. Today we will be discussing a new Silent Spring Institute study showing that everyday products contain a wide range of potentially harmful chemicals, including many that are not listed on product labels. The new study marks the largest investigation that actually tested the products themselves for the presence of many suspect chemicals. Here to discuss the study's findings and tips for avoiding exposures to chemicals of concern is Robin Dodson, lead author of the study. Dr. Dodson is a research scientist at Silent Spring Institute, a nonprofit scientific research organization that focuses on the environment and women's health. Her research centers on developing novel residential exposure measurement methods for epidemiological studies and analyzing household exposure data. She currently oversees the Institute's consumer product exposure research. She also holds an appointment at Harvard School of Public Health as a visiting scientist and as a lecturer at Brandeis University. She currently serves on the board of counselors for the International Society of Exposure Science and the Massachusetts Toxics Use Reduction Science Advisory Board. Dr. Dodson received her doctorate in environmental health in 2007 and her master's in environmental science and risk management in 2004 from Harvard School of Public Health. Welcome, Robin. Would you like to go ahead and begin?
Sure. Thank you for having me. I'm very excited to speak with you today. Good morning to all of you out in Alaska, and good afternoon to you, any of you that are out here on the East Coast with me. As Diana mentioned, I'm going to be giving you kind of a brief introduction and then kind of an overview of our findings from our most recent study on product testing. And I'm excited to share this because I think this is something, we typically get a lot of questions about, and it's nice to kind of share it in this venue. I'll be moving through a PowerPoint presentation that you can get from the website, and I'll try to, periodically indicate when we're advancing slides. So as Diana mentioned, my name is Robin Dodson, and I'm from Silent Spring Institute. And just to give you a little background before I jump into our study on Silent Spring Institute, Silent Spring Institute is a nonprofit research organization. We're located in Massachusetts, and we were founded back in the early to mid-90s, 1994, because activists associated with the Massachusetts Breast Cancer Coalition were kind of puzzled and then found a lack of resources to try to understand why there was a high incidence of breast cancer on Cape Cod in Massachusetts. So those of you who might not be familiar with the geography in Massachusetts, Cape Cod is that it looks kind of like an arm sticking out into the ocean off of the coast of Massachusetts. And it's kind of it's a more rural kind of area, and it's not kind of an obvious place where you might have thought there might be a high incidence of breast cancer necessarily. It's not industrialized in any way. So to try to understand what might be driving this high incidence of breast cancer along Cape Cod, they decided to create something they called a lab of their own. And the reason they felt like they had to create this is because they felt like in the scientific community at the time there really wasn't anyone or any group focused on trying to understand environmental causes to breast cancer or other women's health diseases. So they founded our organization, and we've been working on trying to understand this ever since. Our group focuses both on more Massachusetts-based as well as national research questions. So we feel that while we started kind of in one specific spot or geographic location, really our work is much broader than that. So that's just a little background from where I'm coming from, and now kind of jumping into what kind of research we do and how this started our most recent study on consumer products. So next slide, on slide 3. For those of you who may not be familiar with the idea that the CDC, the Centers for Disease Control and Prevention, put out these national exposure reports. These are reports on how your typical Americans, how much they're exposed to environmental chemicals. Currently, they're looking at over 200 environmental chemicals, and they do this by collecting a random sample of blood and urine from Americans and then quantifying the chemicals within those samples. And this is a great way to try to understand or get a snapshot of what people might be exposed to. And when you look at the results from this testing, you can see that we are, in fact, as Americans, exposed to a wide range of chemicals. Many of these chemicals presumably coming from our associations or interactions with consumer products. So in the next slide, to try to understand this further, we've been conducting some work on exposures in the home. This is part of our where we started from, was trying to understand, okay, well, what are possible environmental sources of chemicals that we might be exposed to? Well, one obvious place is to look inside the home. We have such intimate exposure with the chemicals that we can find in our homes. Chemical concentrations in homes tend to be 2 to 5 to 10 to 100 times higher indoors relative to the outdoor environment. So it seems to be a good place to start to try to understand what we're exposed to in the place we spend the majority of our time. So to date, our institute has conducted a household exposure study that has included over 170 homes. We've looked at 120 homes in Cape Cod, and then added to that study about 3 years ago, looking at additional 50 homes in Northern California. And in these homes, we've gone in and we've collected dust, and we've collected air, and we've collected urine from the residents to try to understand what they're exposed to. And we've analyzed these samples for many different compounds, including 89 endocrine disrupting compounds, or EDCs. When we did this back in about 10 years ago on Cape Cod, this is actually the first time that 30 of these EDCs had ever been measured. So it really gives you an indication of we're kind of on the cutting edge. We're pushing the envelope, trying to understand, well, it seems like the obvious factors are not contributing as much to disease as we think. We need to keep pushing the envelope and keep trying to play detective here and trying to understand what we might be exposed to. So on the next slide, what did we find? So on slide 5, so what did we find? Well, we found about 20 chemicals per home of the 89 that we looked at. We found 67 EDCs in total and 27 pesticides in the homes. This is a kind of a surprising finding. At least to me at first, it makes sense, but it still shocks me every time I see it. But we found DDT, which is banned way back in 1972. We found that still in 2/3 of the homes that we were looking at. So 30 years later, we were still finding DDT. We found phthalates in 100% of the homes. We found parabens and alkophenols, two compound classes very much associated with consumer products, were found in the majority of homes that we looked at. We found flame retardants at concentrations that are 10 times higher than that were previously observed in Europe. When we did this back in the early 2000s, this was the first time actually people were really looking at flame retardants in U.S. samples. And then our follow-up study in California showed California flame retardant levels that were 200 times those found in Europe. We found 15 chemicals at concentrations above guidelines when guidelines did exist. Many of these compounds, since they've never really been looked at before, lacked guidelines. So out of the 39 that actually had guidelines, 15 chemicals were found above guidelines. And out of the 120 homes that we looked on in Cape Cod, over 100 of them actually exceeded at least one health guideline. So we know people are exposed to a wide range of compounds, and we know that they're exposed to levels that may be potentially health relevant. So out of this work, next slide, came several kinds of questions. First of all, were the individual questions, mostly from our participants in the study, who say, okay, now what can I do to try to reduce my exposure? Specifically, what might I be able to do to reduce my exposure while science and regulation are still trying to figure things out? And then this also raised questions on kind of the more, on the national front or the regulatory front, which is what exposure sources might be a priority for control. So where should we start if we're going to start trying to have an impact here? So based on this, based on the fact that we know we're exposed to things that are presumably coming from consumer products, we felt like the next level of inquiry was really trying to do a more comprehensive study to understand the actual exposures within the home and to see what the sources, in fact, might be. Now, one study design that might be particularly useful in trying to understand this question is of what might we be exposed to and how can we reduce that exposure is the idea of doing an evidence-based intervention study. The evidence-based here is basically that we are using information based on previous research to come up with the question and the reduction strategy. And then the intervention is that we go in and we try to perturb the exposures in some way. This is kind of study has been used before quite powerfully. Of note, Alex Liu in 2005 published a paper on organic diet showing the impact of switching children over from conventional to an organic diet and the impact it has on our body burden of pesticides. Last year, Silent Spring Institute published a paper on the impact of food packaging, basically switching to a more fresh food diet and what that can do to our levels of both BPA or bisphenol A and phthalates in our bodies. Another example is just a 5-day vegetarian diet, which is typical from a Temple Stay diet, and they saw a kind of dramatic decrease in phthalate exposures because of the switch to the vegetarian diet. So we wanted to kind of use these kind of templates of an intervention study to really try to understand what might be driving exposures within the home. So to do this and to make it evidence-based, we needed to first try to identify the major sources of the compounds that we know people are exposed to in the home and really quantify that before we would set up our evidence-based intervention study. So what that means is that we needed to figure out what were in the products that people are typically using in the home. So next slide, we identified 50 different product types that people are exposed to in a kind of an everyday kind of basis. We looked at cosmetics, so personal care products like lotions and perfumes and makeup. We looked at cleaning products. We looked at household goods such as shower curtains, kitty litter. We looked at things that you might use to make your own household cleaners. We also looked at sunscreens since there were a couple of specific chemicals in those sunscreens that we were concerned about. And the first step actually was to kind of take the simplest approach, was to say, okay, we have our list of product types that we're interested in. Let's contact those manufacturers and ask them what is in their products. Will they tell us what's in their products? And then could we start our intervention study that way? Probably it's not surprising to learn that, in fact, many manufacturers were not willing to share that information with us. So unfortunately, we had to take the far more expensive route of sending each of our samples off to the lab for analysis. So on slide 9, we are the list of the chemical groups that we looked at. We looked for 66 different endocrine disruptors and asthma-associated chemicals. These included parabens, triclosan or other antimicrobials, alkylphenols, UV filters, cyclosiloxanes, bisphenol A, phthalates, fragrances, glycol ethers, and ethanolamines. Now, endocrine disrupting compounds, to kind of step back, is why are we even interested in those? Well, we know that they can affect things like cancer. We know that breast cancer cells will grow in the lab if they're exposed to estrogen. So we are interested in these things that we call endocrine disrupting compounds, or compounds that disrupt our endocrine system or our hormone system in our body. And this could have impacts on cancer, as I mentioned. It could have impacts on metabolism. It could have impacts on a variety of developmental systems, such as our reproductive development system or our neurological development system. So it could have a wide range of health effects for these different compounds, these endocrine disruptors. We also decided to focus on asthma, since we know that the asthma burden is increasing, particularly for children. And so trying to understand and identify specific asthma triggers could have a very large public health impact. Next slide, to just get in a little bit more detail about which particular chemicals we looked at and their use in the products. Again, we looked at parabens, which are typically used as preservatives. So we looked at phthalates, which we typically hear about as being plastic additives. They're also used as solvents in cosmetics and perfumes, and sometimes in pesticides. We looked for bisphenol A, which we've heard a lot about in the news. We looked at antimicrobials, including triclosan and triclocarban, ethanolamines, which are used as solvents and emulsifiers, alkyl phenols, which are used as surfactants or disinfectants, typically found in cleaning products. We looked at fragrances, which, kind of no surprise, right? They typically add scent to products. They can also be used to try to mask scent in products. And we classified these fragrances into two different groups. Those that are kind of natural or typically from natural origins, and those that are synthetic. Now, I should say that we did not analytically determine whether or not they were, in fact, from natural sources. This is kind of our classification based on where they're typically sourced from. So we can't tell whether or not it was actually synthesized or not. But we looked at both natural and synthetic fragrances. We looked at glycol ethers, so slide 12, which are used as solvents, and those have been associated with asthma in previous work. We looked at perfluorinated compounds, actually just one. We looked at cyclosiloxanes and UV filters. Those were both added during a kind of a second round of sampling. Those cyclosiloxanes are found in a lot of products that might be used for people with curly hair, so they enhance conditioning and spreading, and UV filters, which are not only used for skin protection but also for product stability. So that's kind of a long list of the different actual chemicals that we looked at. And now a little bit about the study design on slide 13. So to try to understand what people are typically exposed to, and then to try to understand what specific products we should be targeting in our intervention, we split products up in two different ways. We looked at what we termed as conventional products. Those are typical products that we might be exposed to, and then alternative products. Alternative products are those products that met a specific criteria that we established before the study, that we believed this criteria would help us identify products that had little or no chemicals of concern. So this is based on our research and what is available out there. We decided to come up with a series of guidelines to try to pick these products. So that's how we found those alternative products, and those products actually had to say they specifically did not contain our chemicals of concern, or they somehow otherwise on their label would indicate that they are free of those of chemicals of concern. And then all other products, or your kind of typical products, would be conventional products. And those conventional products, since we were trying to really understand just kind of your typical exposures or generalized exposures, we composited many of those conventional products into samples that we then analyzed. So say we wanted to look at laundry detergent. Well, we didn't want to just pick one laundry detergent because, what if everybody's not using that specific brand? Instead, we took 4 to 5 products and put them together in one sample and analyzed that as kind of a one sample as one kind of general potential laundry detergent, say. Now, the alternative products, though, we did analyze all individually because, again, we're really trying to design this intervention study where we're trying to identify products that we can intervene with to try to reduce exposure. So we really need to understand specifically what was going on in each of those products. I go through this detail here basically to try to give you some background so in terms of interpreting results. In most of the cases here, the idea here is that I'm trying to dissuade you from going comparing one conventional sample to one alternative sample because it's not quite appropriate to do that. But we can think about the results in kind of a more general sense. So next slide, on slide 14, here is the criteria that we use to try to select our alternative products. So we looked for products that were free of parabens, ethanol, amines, 1,4-dichlorobenzene, which is an antimicrobial, non-ionic surfactants, since we were trying to avoid exposures to alkylphenols. We looked for fragrance-free products, although we did allow for natural fragrances. We tried to avoid tea tree oil and lavender, since one study did show that it may be a potential, those two oils may be potential endocrine disruptors. We tried to avoid triclosan, triclocarban, general kind of claims of being antimicrobial or antibacterial. We avoided products that were called stain resistant. We avoided vinyl, and then petroleum-based products in general. And I should say that all of our alternative products, or most of them, were selected from a store that already kind of had their own criteria. So it's a national store that is focused on natural food. Now, next slide, we can dig into some of the results. So what did we find? This first slide here with the orange are the conventional results. And what's going on here is I have along the bottom axes there, I have listed the different types of products. So we go from cat litter, pillow protector, all the way over to sunscreen. The numbers that are associated with each of those product types are the number of individual products that we included in that sample. So we looked at 3 cat litters, composited them together, and here is kind of the average result. Okay, and then along the left-hand side there are listing all the chemicals that we looked at. And so what did we find? Well, here I'm only listing 55 of the 66 chemicals because we found 55 of those chemicals. There were several compounds or chemicals that we did not find, but we did, surprisingly, or not so surprisingly, I guess, find the majority of the compounds that we looked at. Moving across along the bottom here, we start with things that are typically kind of household goods, going into cleaners, going into personal care products. We then hit a line just past mascara that is basically anything to the left of that line. All of those to the left are things that we looked for at corresponding alternative products, while things to the right were only analyzed as conventional. So, right, vinyl was one of our criteria, so there's obviously no alternative counterpoint to that, so here our vinyl shower curtain is listed by itself. So what are some of the interesting findings? If you look, say, at the vinyl shower curtain as an example, if you move all the way up there, you can see that number all the way at the very top there, 4, is indicating that we found 4 chemicals in that, of the 66 we looked for, in that vinyl shower curtain. Of note, though, are the concentrations that we found. And here I'm showing just concentrations in bins, right? So about 1 to 100, 100 to 1,000, or greater than 1,000. In the vinyl shower curtains, we actually found DEHP, or bis-2-ethylhexyl phthalate. That's the dark orange square there. We found that at 28% by weight. Now, that's significant. That means that over a quarter of that shower curtain is DEHP. And DEHP has been associated with a variety of outcomes, including adverse reproductive outcomes in males specifically. So that's a very interesting and kind of concerning finding there, was the high levels of DEHP that we were finding in our vinyl products. Another product that we found high levels of DHP, or bis-2-ethylhexyl phthalate. Moving towards the left was the pillow protector. We selected this pillow protector because often asthmatics seek ways to try to reduce asthma triggers, one of which might be to use a pillow protector to decrease their exposure to dust mites. And if they're choosing a vinyl pillow protector, in this case, they're exposing themselves to DHP quite intimately, right? They're laying on that pillow for multiple hours a day in close proximity, and that pillow protector actually contains about 14% by weight DHP, which, while DHP has a variety of reproductive outcomes, adverse reproductive outcomes, it's also been shown to be associated with asthma. So this is rather concerning, considering that asthmatics might be seeking this exact product that then might be exposing them to another asthma trigger. So generally, if you're looking at these conventional results, this orange graph here, you can see many products had many different compounds. Right, we go from anywhere from 2 all the way up to 22 different chemicals. So all of our conventional products had at least one of the chemicals of concern. And some of them had obviously much higher levels than others. Moving on to the next slide, here's a graph. You see a lot of blue squares here. These are alternative results. So the results for the alternative products. Again, we're looking at one product specifically. So we looked at one cat litter, say, or one pillow protector that we had selected based on our criteria. And your general reaction might be, wow, there's a lot less blue on this graph than there was orange on the last. So yes, we were finding much less in these products. We found, in fact, 11 products that had no chemicals of concern. So those would be all those products that if you look up on that top margin there, you see the numbers. You can kind of scan across, and wherever you see 0 means that we didn't find any of our compounds in that specific product. And so you can see here, in general, the concentrations are lower. We don't see as much blue, so the detection frequencies aren't as great. And there seems to be some viable alternatives to the previous conventional products. So, we were able to identify, say, shower curtains that did not contain, they were both cotton and nylon shower curtains that didn't contain any of our chemicals of concern. So that might be an easy choice for an intervention, where you might select a cotton or nylon shower curtain instead of the vinyl, and thus, removing all of that DHP from your home. Okay, so moving on to just kind of summarize some of the findings. Overall, out of the 66 different chemicals that we looked at, again, these chemicals were identified as either being endocrine disruptors or asthma-associated chemicals. We found 55 of them. All of our conventional samples had detectable levels of at least one of our chemicals. 32 out of our 43 alternative samples had these detectable levels of the chemicals of concern. That means that 11 of the products, in fact, had none of the chemicals of concern. The highest concentrations were for DHP, as I mentioned, the shower curtain at percentage levels. Fragrances, not surprising, right? They add them to really, they serve an obvious purpose within the product. DA, that's a diethanolamine, that's an asthma-associated chemical that was found at rather high concentrations. We found glycol ethers and UV filters at concentrations above 0.1% or around 1%. The largest number and highest concentrations were for sunscreens and fragrance products. These are, for the sunscreens, typically those UV filters are added as active ingredients, so typically at percentage levels so that they're effective. And then fragrance products, we tend to find those things such as like dryer sheets or perfume itself, right, are going to have high levels of fragrances. Vinyl products, as I mentioned, had rather high levels of DHP, finding up to 28% DHP by weight in that shower curtain. And then we also found, this was kind of interesting, was that we found 3 phthalates in the alternative products that we did not actually detect in our conventional products. This would indicate or suggest potentially that perhaps manufacturers are moving away from those phthalates that are more well-studied or perhaps regulated to phthalates that are less well-studied. Unfortunately, these phthalates that they seem to be substituting with also have endocrine disrupting effects. So it's kind of is a real kind of call towards this. We need to test these chemicals before we put them out on the marketplace, because are we just going to keep going through the same cycle, putting a chemical in a product, realizing that it's harmful, and then having to pull it out, and we keep kind of moving in a kind of a cycle or constant cycle there of products or chemical substitutions. What else? So in terms of mixtures, on slide 18, we did this analysis where we, not only did we look at the individual products, but we decided to look at kind of correlations. So what did we find chemicals often together? Was there a co-occurrence of chemicals? We found 0 to 22 different chemicals in a single product type. So that means, for some of those alternative products, you aren't exposed to these chemicals of concern, but in some, you're exposed to 22 chemicals of concern. And what that means is that it can really add up. We also did this correlation analysis where we looked at, are there certain chemicals that might be correlated with others, which might indicate a kind of a common mixture within these products. And what we did find was actually that, say, DEP, which is a phthalate, diethyl phthalate, was correlated with many of the different fragrances. This indicates that it might be used, there might be a use for this DEP when you're introducing fragrance into the product. So it might be a carrier to these fragrances. So that might be a common mixture that perhaps we want to try to investigate further, say in toxicological studies. It also is interesting in terms of there's been several epidemiological studies that have found an association between reproductive outcomes or reproductive developmental outcomes and DEP. And while in the lab would suggest that DEP is not necessarily responsible for those outcomes, its correlation with fragrance products, which may be endocrine disruptors, maybe perhaps it's actually the fragrances causing those problems rather than the DEP. That's something that, we should it brings up another research question that needs to be analyzed further. These results also show how if we use a common array of products, so if we use alternative surface cleaner, tub and tile cleaner, laundry detergent, bar soap, shampoo and conditioner, facial cleanser, lotion, and toothpaste, things that we might use on a daily basis, we're exposed to up to, say, as an example, 19 target chemicals. So the more you use, the more you might be exposed to. I mean, that's kind of intuitive, but it really is begging for the idea that we should be kind of going towards more of a simple route, keeping things very simple, using less products. So this kind of mixture analysis, or understanding how things or chemicals might be co-occurring within these products, has implications on a variety of things. They have implications on toxicity testing. So as I mentioned, when we were looking at correlations, we might identify mixtures that are commonly co-occurring. So perhaps we should be doing our toxicity testing with that mixture itself rather than the individual compounds. There's implications for risk assessments in terms of thinking about cumulative risks and cumulative exposures. And there's implications for epidemiology. Again, thinking about potential confounders, so things that might be, maybe perhaps it is the fragrances rather than the DEP that is causing the observed health effects in those epidemiological studies. Now I should say, as probably as the title has kind of indicated, that we looked at the labels here. So not only did we look at the labels when we were trying to identify the products themselves as being alternative, but we then went back and we did a label analysis. So we looked at what did we actually detect in each of the products, and what did the labels say, and was there an association between the two. Now we found that it is possible to avoid some of our target chemicals through label reading, but unfortunately it is not possible. Our criteria was not comprehensive, and you could not reduce your exposure to all of our target chemicals by following our criteria. Generally, our criteria did not work, unfortunately, for trying to avoid exposures to phthalates, because they are typically never on a label, ethanolamines, and alkyl phenols. Generally, though, our criteria work to try to avoid parabens, because they tend to be labeled, antimicrobials, because things, you're typically promoting things as being antibacterial, so things like triclosan might be easier to try to avoid, and UV filters, because again, if they're used as active ingredients, they have to be labeled according to the FDA. So slide 20, some conclusions and some implications. What does this mean? Well, we know that based on this, we can clearly see that exposures add up for multiple products. The more you use, the more potential exposure you have to these chemicals of concern. We know that toxicity studies and risk assessments need to think about mixtures. This is quite clear because we're seeing these chemicals co-occurring in the different products. This raises concerns for epidemiology because of confounding and potential misclassification. If we just went out and asked somebody, do you use laundry detergent? What this is showing is that perhaps based on the variation that we're seeing in the different products, that might not be the best way of doing it. Instead, we actually need to either measure it directly in that person, measure it in their home, or measure the product that they're using. This has implications on labels, because we know that labels, which can facilitate consumer choice for regulated active ingredients, so things like our UV filters and our antibacterials, those are typically labeled because they're active ingredients, so we can use those labels to help us avoid those chemicals of concern. You can use labels, it would appear, to try to avoid synthetic fragrances, and at this point I should note that fragrance-free is different than unscented, right? When we typically see things as unscented, it means that fragrances might have been added as masking agents, while fragrance-free means that there is no fragrance in that product. And bisphenol A. Now, bisphenol A is typically not labeled, but what was interesting is if you kind of spend some time staring at those colorful graphs, you would see that we never detected bisphenol A in any of our alternative samples. Well, we did detect it in our conventional samples. And we don't necessarily know why this is. It was never labeled, but perhaps it's those alternative products are not using materials that are based out of bisphenol A, or perhaps they're processing, their kind of manufacturing processes are without bisphenol A. But somehow, using our criteria, you are able to avoid bisphenol A exposures. We also know that if we were going to conduct an intervention study based on this work, we can focus on vinyl, fragrance products, and then reducing the number of different products that we use. Again, that will reduce our potential exposures. And then if we find alternatives to sunscreen, since sunscreens did represent some of those products that had our highest, largest numbers and highest levels of chemicals of concern. So doing alternatives to sunscreen, such as shade or different clothing, can also reduce exposures. And then on slide 21, it's just a slide to provide you with more information. We actually have a designated website for this at silencespring.org/product test. There you can find a link to the article, which will be published in July in print, although it's available now ahead of print. A fact sheet, which is kind of a lay summary of the study. Some tips cards, both a wallet size and a regular tip sheet. We do, partially out of a kind of a call from consumers, is that we do also provide a list of the product names that we analyze, so you can go and find both the conventional products and the alternative products that we analyzed. And you can also see a short video there summarizing the findings. And I should note that this study was funded by the U.S. Centers for Disease Control and Prevention, the Goldman Fund, and the Hurricane Voices Breast Cancer Foundation. Next slide, I just kind of wanted to show some of the media attention that we got from this. This study was actually published online at the beginning of March, and we actually got a fair amount of media coverage for this, which was great because it kind of got it out there. And not surprising, many of the things that were kind of picked up were the ideas that we're finding things in a wide range of products. We're finding chemicals of concern in products that we thought might be safe based on our criteria. So, kind of the major headlines that were coming out of this. Now, as promised, we have a couple tips based on our research. that can help you try to reduce your exposure to these chemicals of concern. These are tips that were generated based on this research, so it's really evidence-based tips. So the tips include choosing fewer products, choosing plant-based ingredients, using things like plain water, baking soda, and vinegar for cleaning, and using shades, hats, and lightly woven fabric cover-ups for sun protection. Again, those alternatives to sunscreens. So those are kind of active things you can do. And then a couple tips on what you might want to try to avoid. Fragrances. In general, this is the easy thing to do, I think, in terms of it's kind of the low-hanging fruit, right? It's just choose fragrance-free products or just products without fragrance in them. That's for both cleaning and personal care products. Try to avoid vinyl in your home, since we know that DHP is found at percentage levels in those products. And avoiding antibacterials or antimicrobials in soap and toothpaste. We're lucky because these are typically labeled, so if you flip over that product, say your favorite toothpaste, you might see that it would say triclosan on it. This is one that's a little bit easier to try to avoid. Going with more tips here on the next slide, avoiding stain-resistant furnitures and sprays and clothing. Now, we actually didn't find the stain-resistant or the perfluorinated chemical that we analyzed to try to see if they might be out there, but there's a broad range of chemicals that would fall into this. We only picked one, and I think it's something that certainly there's a potential for exposure there in the home. Avoiding lavender and tea tree oil based on one kind of medical case study. Avoiding parabens. Looking for things like paraben-free or any of the chemical names that might include paraben on them. Avoiding cyclohexyloxane, so what you're going to look for on the back of that product is something called cyclomethicone, and those are typically found in sunscreen and hair products. So again, if you want to learn more about this study and as well as some of our other research, I encourage you to go to silentspring.org. On the left-hand side, you'll still see a link to that specific website for our product testing study, and you can also learn about our most recent research and what's most recent at Silent Spring. So that concludes my summary of the study, but of course I'm very excited to answer any questions that you might have.
Thank you so much, Robin. Thank you for your time today and for sharing your research with us. And the work of Silent Spring Institute is really invaluable to consumers, environmental health advocates, and policymakers, and we appreciate all that your organization does.
Great.
I'd like to turn now to discussion, especially given the numerous implications of the study's findings. I think we'll have a lot of questions. So I'm going to go ahead and unmute the lines. Please wait just one moment. If you'd like to ask a question or make a comment, please press *6 on your telephone to unmute your line, and please state your name and affiliation. We also ask that you please try to be brief with your comments to allow others the opportunity to speak as well. So the lines are now open if you press *6 on your telephone.
Hi, can I grab the microphone?
Yes, please
Virtual
go ahead.
microphone. My name is Jake Cole. I'm from Canada with a group called Prevent Cancer Now. I thoroughly enjoyed the presentation. Had a whole pile of questions, but one of them comes to mind right at the top. Does the results of your study have any effect on authorities such as your health department in the U.S. or the Environmental Protection Agency? Have any of them planned to take any action as a result of what appears to be kind of groundbreaking results you've got there?
Yes, thank you. We have been in touch with several groups, and in fact, actually, one of the organizations or agencies that was really calling for this information was the EPA, and I found it kind of quite disappointing to know that our federal government actually had to reach out and actually ask of this information from independent researchers because they, in fact, did not have it for themselves. So the EPA has actually asked for this information. They knew it was coming, and we are actually going to be sharing that information with them, so they can they'll have all of our data that we looked at for this study. So we're hoping. I mean, we're hoping really this calls for, toxic chemical reform, really calls for something for this Safe Chemicals Act, but we're hoping at least kind of as first steps the EPA is taking our data, and hopefully we'll try to make change with it.
If I could slide in a second one, then I'll keep quiet. Some of the ingredients that are toxic that aren't listed on these various products, is that illegal?
So that's a good question. So according to FDA, you have to include things, so it depends on the product type, I should say. Okay, so for personal care products, so things like cosmetics, according to the FDA, you do have to label all of your intentional ingredients in the product. So if things were added there intentionally for a specific purpose, you do have to include them on the product label. Now, it means that there's certain things chemicals that might be introduced during processing or that are not added as an intentional ingredients, but may be in there that do not have to be labeled. So things like DEP, that phthalate that we were finding that was not listed, typically I imagine what's happening there is that is actually what's coming in under labeling of fragrance. So fragrances are things that all they have to do is write fragrance. They don't have to tell you what that might be. And fragrances can be a mix from anywhere, to 1 to 2 to 5 to 100 different chemicals, and all they have to do is label fragrance. So it's kind of a way they can get around listing their specific ingredients. Now that's for personal care products. Now for cleaning products, unless there's some sort of antimicrobial or antibacterial property, which means that it would fall under pesticide regulations, there's no requirement currently for listing ingredients on cleaning products. So if you were to pick up your regular old cleaner and turn it over, you would probably really not see any ingredients listed on that, depending on the brand, but listed on that cleaning product.
Wow.
Yeah.
Okay, thank you very much.
Sure.
Hello, this is Fran Solomon from Seattle. Thank you for your excellent presentation. I teach courses about impacts of EDCs, and I was wondering, in your research, have you come across any sunscreens that do not contain endocrine disruptor chemicals?
So we looked at a composite of 4 conventional sunscreens, and what's quite clear is that we found a lot of chemicals in the composite sample. And then I actually didn't show it here, but if you look in our paper, you can see that we analyzed 5 alternative sunscreens, so those sunscreens that met our criteria as individual, to try to understand the variability that we might be seeing in our products. And we actually were not able to identify any products, any sunscreens rather, without any of our chemicals of concern. So that being said, there may be some out there. We didn't capture them based on our criteria. But of course, there may have been other options out there. So I can't say definitively that there isn't anything out there without sunscreens in it, but at least in the 5 that we looked at, we found all of them had chemicals of concern in them.
Okay, thank you.
Hello, my name is Sean K. Byman. Could you hear me?
Yes.
Okay, I'm with SKB Health Coaching in Southern California, and I'm looking at this more from the end result where, in addition to avoiding these products and different chemicals, I'm more concerned too with since we're practically surrounded by them, I'm wondering too if there's any great or good methods of getting rid of them from your body. I understand certain detox programs, healthy detox programs, but I'm wondering also, I concern myself with movement and intense exercise, so I don't know if you guys have any information on how to rid yourself of, like, specifically parabens or phthalates, and also, do they typically store themselves in fat? Are they found in organs? How do they manifest, and how do we get rid of them once once we've been surrounded by them for so long?
That's a good question. Our research doesn't specifically focus on that, although I will say that several of our research projects could address that question. The first is being that, I should say that many of these compounds that we're looking at, so parabens and phthalates and say bisphenol A, have relatively short half-lives in the body system. So phthalates, for example, will last probably just a couple of days in your body. So you can potentially, draw your levels down significantly by reducing your exposure to things that might contain phthalates. We saw this with our diet study, right, where we saw we had people switching diets, and we could see a marked decrease in their phthalate exposure because your body was naturally clearing it out. But of course, it took several days to do it. So yes, several of these compounds that we looked at will only stay around in your body for a couple of days. That being said, certainly there are others that are more fat-loving and may stick around for a lot longer. But actually, most, just kind of scanning over the list of the ones that we looked at, most of these will have fairly short half-lives, except for perhaps those cyclosiloxanes, which will, those might be things that might stick around a little bit longer.
Thank you.
Mm-hmm.
Again, press *6 on your telephone to unmute your line if you'd like to ask a question or make a comment.
My name is Vi Wari. I'm from St. Lawrence Island, Savunga, Alaska. I'm also with Alaska Community Action on Toxics. And I'd like to thank you for this wonderful presentation. I put it out there that our organization is working with the leadership and communities of St. Lawrence Island on a community-based project. And because of military contamination concerns, and also we are being disproportionately affected through our traditional foods of persistent organic pollutants or global transport of contaminants. We will be doing a household study and also looking at these newer class of chemicals. So I just wanted to let folks know that, once our communities give us permission, this information will be available. So look out for that. And, it's will be one of the few that will be done within the state.
Great. I think I'm glad to hear that you're kind of furthering some of this research.
Thank you.
Thank you, Vi.
This is Paula Williams. I'm the Sustainability Director at the University of Alaska Anchorage. A prior caller asked about how long a lot of these chemicals stay in our bodies, and you said that most of them are not long-lived. But I'm wondering, do you know what happens to them? Are they actually broken down, or do we excrete and urinate them into other, into sewer systems and things like that?
That's a very good point. So yes, most of them you will, your body conjugates them, which, slaps on something basically to kind of alters the chemical structure just slightly, and then you do excrete them. So it is possible that some of these chemicals are certainly passing through our bodies and being excreted, and then we're finding them some in our waste streams. Actually, that's kind of a whole another area that Silent Spring is looking at, is some water impacts of household product use and pharmaceuticals. So yes, we are finding these, unfortunately, out in the environment, presumably from not only our use in the home, but also our use on ourselves that has kind of passed through our body and then ends up out in our waste streams.
Thank you.
Mm-hmm.
Hi, this is Pam Miller with Alaska Community Action on Toxics, and thank you, Robin, for this excellent work. And it's really, I think Silent Spring's work is so pioneering, and we've all been inspired by it. Thank you. And my question is that I've been really concerned about the levels of flame retardants, and your findings were quite stunning. And I'm wondering if your findings have had any effect or implications for the decisions and hearings going on in California concerning the flame retardant flammability standards.
Mm-hmm.
And then just if you could say a little bit more about policy implications and any interest either in states or nationally about your findings.
Oh, that's great. So, yes, we haven't, as I mentioned in our household exposure studies, we did look for flame retardants and found them at very high levels. And actually, we did publish a follow-up study to our California results showing that in California was much higher than we were observing in Europe and much higher than we were observing even in other areas of the U.S. And that we can see that actually if you look at that CDC biomonitoring program and Haines, you can see that Californians have much higher body burdens of flame retardants compared to other U.S. residents, presumably because of their state furniture flammability standard in their state. And so, yes, that paper specifically, which was published by my colleague Ami Zoda, is very much impacting what's going on in California right now, and they're kind of calling attention to that. And we actually have been doing some follow-up testing in California now, trying to understand what types of flame retardants people are exposed to and if those flame retardant concentrations are changing over time, which I'm working on right now. As for implications, clearly that had implications on some regulations on the state level. We're hoping that some of these results from our product testing will have some implications, say, at FDA or EPA in terms of transparency of labeling and hopefully some, trying to reform TSCA and things like that.
Thank you.
Mm-hmm.
We could probably take one more question if there's someone out there. Okay then, so we're just about out of time, but before closing, I'd like to remind everyone that our teleconference seminars are archived and available for download on our website at akaction.org. And I want to thank you again, Robin, for joining us today, and to everyone who called in from Canada and across the U.S. and Alaska. Our next Che Alaska call will be on endocrine disrupting chemicals, new directions in science and policy, with Carol Kwiatkowski, Executive Director and Senior Research Associate at the Endocrine Disruption Exchange, or TEDx. The call will be on Wednesday, July 25th at 9 a.m. Alaska time, and you can sign up by emailing me at diana@akaction.org. And there's also a web page set up for this call on our website with more information and resources. Thank you again, and if you have additional questions or comments, please feel free to contact us by phone at 907-222-7714 or by email at diana@akaction.org. And many, many links are available on our website for the call today, including the tips that Robin mentioned and articles and all sorts of things. So please check that out. And have a wonderful day. Thank you.
Thank you very much.
Thank you.
Thank you. Thank you. Bye-bye.